14 warning signs your body needs more magnesium. Magnesium is an essential mineral that's needed to keep our bodies in great shape, and it's one of the most common deficiencies among people in developed countries. Here are some of the warning signs you might be magnesium deficient, and what to do about it. 1. You can't sleep. The most common symptom of magnesium deficiency is difficulty sleeping. You may also experience anxiety, muscle pain, and/or frequent headaches. If you have any of these symptoms, it's a good idea to see your doctor for blood testing or a hair test to check your magnesium levels. 2. You're always tired. The first warning sign your body needs magnesium is that you're always tired. One of the main functions of this crucial mineral is to help produce energy, so if you're feeling tired most of the time and don't know why, it's a good idea to talk with your doctor about getting more magnesium in your diet or taking supplements. You can also try drinking lots of water and adding foods rich in magnesium like leafy greens, avocados, beans, figs, nuts, seeds, and dark chocolate. 3. You have anxiety or depression. Magnesium is necessary for the body to produce serotonin, which is a neurotransmitter that helps regulate mood. Having too little magnesium in the body can lead to anxiety or depression. 4. You have trouble staying focused. It's hard to stay on task and get anything done when your body is screaming for magnesium. The most common symptoms of a magnesium deficiency include fatigue, weakness, muscle cramps, restless leg syndrome, headaches and dizziness. If you have any of these signs or symptoms, it may be time to up your intake of this important mineral. 5. You get headaches. You might get headaches if you're not getting enough magnesium. It's important to get your magnesium levels checked when you have a headache, because it could be a sign of something more serious. We recommend seeing your doctor if the headache lasts for more than 2 days. 6. You have muscle cramps. Some of the more common signs of magnesium deficiency are muscle cramps and spasms, tremors, seizures, and convulsions. If you have any of these symptoms, it is important to get tested for a magnesium deficiency as soon as possible. 7. You get dizzy. A lack of magnesium in your system can cause dizzy spells. To make sure you're getting enough, try adding more foods with magnesium or taking a supplement. 8. You have PMS. PMS is a symptom of magnesium deficiency. Symptoms include mood swings, fatigue, and abdominal cramps. PMS can happen to anyone at any age. Other symptoms include headaches and insomnia. The recommended daily allowance for magnesium is 400 mg per day for women between the ages of 19 to 30 years old, 420 mg for women between 31 to 50 years old, and 420 mg for women over 50 years old. 9. You have osteoporosis. Osteoporosis is a disease where bones weaken and become brittle, leading to an increased risk of fractures and breaks. In the US, it affects over 10 million people, with half of them being women. It can be caused by a variety of things, including lack of vitamin D or magnesium, smoking, or genetics. 10. You have asthma. Asthma is a chronic respiratory disease that inflames and narrows the airways, making it difficult to breathe. You'll usually experience symptoms like wheezing, coughing, chest tightness, and shortness of breath. Asthma can be acute or chronic, and can come on suddenly or develop slowly over time. Lack of magnesium in the body can cause asthma. 11. You have heart disease. If you have heart disease, you may be at a higher risk of developing magnesium deficiency. One study found that patients with coronary artery disease were likely to have lower levels of the mineral in their cells. Magnesium is an important mineral for cardiovascular function and has been linked to lowered blood pressure, improved cholesterol levels, and reduced inflammation throughout the body. The good news is that there are plenty of ways to get more magnesium into your diet. 12. You have type 2 diabetes. Some of the warning signs that you might need more magnesium are muscle weakness, numbness, and tingling. These symptoms can be attributed to many other things as well, like nerve damage from diabetes or lack of vitamin D. However, if these symptoms are occurring and you have type 2 diabetes, it is a good idea to talk to your doctor about getting more magnesium in your diet. 13. You have migraines. Migraines are typically characterized by a throbbing or pulsating pain on one side of the head. The pain is usually moderate to severe and can last for hours. Other symptoms include nausea, vomiting, and sensitivity to light and sound. These symptoms may be caused by magnesium deficiency, which can result from an inadequate diet, or an underlying health condition such as kidney disease, endocrine disorders, or gastrointestinal conditions such as Crohn's disease. 14. You have chronic fatigue syndrome. Having chronic fatigue syndrome can be really hard, but it doesn't have to be. Magnesium is a mineral that helps the body break down glucose and metabolize fats and protein. If you have chronic fatigue syndrome, it is important to make sure you are getting enough magnesium in your diet or taking a supplement.